Shai. So I'll ask the first question. As I was listening earlier, this question is for Dr. Christine Magtubo. So based on your work with the rural communities and in mobilizing more volunteers for the program, can you share with us some insights on where else innovation in healthcare is needed?
Okay, where else innovation is? So I think this was a question that's a little bit touched also yesterday. Where else innovation in healthcare is needed? So a lot of things are coming up in the world today. So what I talked to you about is biomedical devices. So the biomedical device industry in the Philippines is growing or starting to grow. A lot of traditional device manufacturers or EMS companies are turning their heads into healthcare and looking at how they can manufacture biomedical devices locally and more cost effectively. Another thing is health informatics. It's been around for quite some time, but the government, with PhilHealth backing it up, is really pushing health informatics forward. In a way that can be rewarding not only for hospitals, for the big tertiary hospitals, but also for lying-in clinics, for rural health units, for basically everybody who deals with electronic medical records. So that's going to change things a bit. Another thing is social media for healthcare. I think in the past 10 years, social media has democratized a lot of things. And for healthcare, it's really redefined the relationship between doctor and patient, because you're a little bit exposed in social media. A particular initiative that we're very proud of and I'm very proud of to be part of is HealthXPH. So in 2016, it held the first patient-included conference in the Philippines. So it's a social media, so we use Twitter to hold tweet chats in, so there's a tweet chat later at 9 o'clock. It's going to be on artificial intelligence, which is also a growing field. Artificial intelligence in healthcare. So we talk about healthcare technology use and how the landscape of health is changing in the Philippines. So everybody's welcome to come. So those are kind of the trends that are happening now. But what I want to challenge everyone to do is to think about innovating for healthcare in terms of inclusivity. Because all of these technologies are already out there in the world, but I feel like we're not reaching the people who need these technologies. And that's always a challenge. So yesterday I posed the challenge of connecting the disconnected, including the not included in the technology revolution. And that's the same thing that I want to echo today. So if you want to develop something for health, awesome, you know, you use your best minds to do it, but do it with the perspective of who's gonna use this, who's gonna benefit from this, and how do I get it from my lab to their hands. So that's something that has to be included in the design, as well as cybersecurity should be included in the design.
All right, thank you, Dr. Christine.